Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn, Szabo. And we were going to be talking about the pool this week, but we had a bunch of things happen. And not happen this week, too.
And alas.
And alas, yeah, including we had a big storm, a bomb cyclone, blew out a window at the pool. So they had to drain the pool to get the glass out, which changed the timing of this whole big arrangement that they've worked up with the neighboring community here for ensuring access to a pool and swimming capabilities for the winter. So all of that's in flux. We bumped that down the road a couple of weeks. So we've got something else to talk about this week.
Yeah, pink eye, a.k.a. conjunctivitis, a.k.a. every parent's nightmare.
It's not a fun time, no.
Yeah, it's right up there with head lice and maybe scabies or MRSA, stuff like that.
Right.
I mean, it's parents, and it's usually moms in the exam room, are quite alarmed by it.
Mm-hmm.
So, but I thought I should talk about it because it's not as straightforward as people understand it to be.
Okay.
Yeah. So conjunctivitis is an inflammation of the conjunctiva, which is actually the inner lining of the eyelid.
Oh, wow.
I know. We were all thinking it was the sclera, which is the white of the eye. But it's the conjunctiva.
Sure. We all were.
Yeah, we were just talking about that. Anyway, and the causes are mostly viral. It kind of depends a little bit on what your age group is and what your risk factors are. But it is assumed by non-medical providers everywhere to be almost always bacterial. Mm-hmm. But there's also allergic, autoimmune, and then things like chemical irritants.
Because that's typically what you do when you take your kid to the doctors. You end up coming home with, I forget which one.
The eye drops.
Yeah.
I usually give kind of a different one from the standard because the standard doesn't work very well anymore. Mm-hmm. But they can't get back into school until they've been on antibiotic eye drops.
Really?
And so it kind of doesn't matter what the real cause is. The thing is getting them back in school.
And that's just common policy?
Yeah. So they're, viral conjunctivitis is like way overtreated with antibiotics, but.
Now, which you've listed a bunch of possible causes for this inflammation.
Right.
What's the most prevalent?
Well, it depends who you are. So, bacterial conjunctivitis is actually more common in children, but it's not 100%. And viral conjunctivitis is way more common in adults.
Wow. Okay.
Yeah, they're hard to tell apart in the exam room.
I bet.
And there's no real good test we can do. It's kind of clinical judgment.
Does that say anything just about the development of the immune system, that you're more, that it's bacterial for children and viral?
It's more the development of awareness of germ theory of disease.
Is that really what it is?
Yeah, you don't stick your fingers up your nose and then, maybe in your eyeball.
Okay.
So that's what I think. At least that's how the moms represent it to me. And as a mom, that makes sense. So rates of children less than a year are 80 cases in 1,000 patient years, which is kind of a lot.
Wow.
But as kids get to be over the age of 4, it drops to 12 cases in 1,000 patient years.
Oh, that's a big
drop. So kids
drop.
learn something about, where their fingers should be and not.
So, and that's just a behavioral shift then that changes that. Wow, that's
an
interesting.
awareness of germ theory of disease.
Well, yeah, and getting potty trained,
Yeah.
all kinds of things.
All kinds of things. Yeah. But about 3% of ER visits are for conjunctivitis, and this
really,
what? This really surprised me.
Wow. Why can it present that horribly? That you I can't imagine ever going to.
No, I think it's a little bit because people worry about their kids' eyes, and I think it's a little bit about the desire to get the kid back to school on Monday. So you decide on Saturday you need those drops today, and you forget there's an acute care clinic at Saturday at Del Mar where I treat a lot of this, and you just go for the ER.
Okay.
Yeah. So starting with bacterial causes, that's the usual list of suspects.
Right.
So staph, pneumococcus, and Haemophilus influenza. But gonorrhea and chlamydia
Oh, that's no
could
fun.
also be causes of resistant cases.
Yeah, chlamydia of the eye. That just sounds horrible.
It is horrible.
Is
And
it, I mean,
looks
does it present?
horrible.
Does it present? Is there any difference in the way this presents in the eye? I mean, is it all just pink eye?
I think it looks just even more disgusting.
Is it just more pink
Especially
eye?
with gonorrhea. Gonorrhea has that habit of producing pus.
Ew.
Yeah.
Okay. All right. All
Yeah.
right.
And, unfortunately, newborns can get this depending on what kind of prenatal care their moms have gotten.
Mm-hmm.
And also, I did see a lot of this in Humboldt County with the student population. And there is kind of a variant of chlamydia, which it's not really chlamydia in the eye, but it's an autoimmune reaction to a chlamydial infection.
Okay.
Where people get what looks like pink eye.
Okay. Okay.
Yeah. So, just something to keep in mind, especially if you have pink eye that's a resistant case. So you're being treated appropriately for the appropriate diagnosis and you're not getting better. The next thing to do is probably culture for gonorrhea and chlamydia if you have risk.
Oh, wow.
So
Wow.
the other bummer for bacterial is that contact lens wearers get weird eye infections.
I bet.
Partially because they're not using their contacts correctly. And, they fall asleep in them or they don't, especially for the disposable ones, they use them too long. They don't change them out. They don't keep them clean. And they usually get a pseudomonas. That's why a lot of the drops now that are used are kind of skewed toward treating for pseudomonas because it can be a common.
What's Pseudomonas?
It's a kind of germ.
Okay.
It's a family of germs.
Okay.
And they're ubiquitous, so they're, you probably have them on you, I have them on me. But the reason it's not causing a problem in our eyes is probably neither of us are contact lens wearers. I know I'm not.
Yeah.
But, so they're really, it used to be that if a contact lens wearer got pink eye, the eye doctors in town would snatch them up and take them away because it was considered such a risk to their vision. But we don't have eye doctors here anymore, so that really doesn't happen.
Snatch what up and take them away? The contact lenses?
They would, if I would call, one of the eye doctors in town, and luckily I had a good relationship with them, and I would mention contact lens wearing, they would say, just send them now.
Really?
Yeah, and super responsive to the whole consult situation by taking my calls, by being willing to see them, willing to keep them out of the
Why
ER.
was that? Why was that? They're just good doctors, good individual
I
doctors?
think they're a little bit, they're really excellent physicians. And I think they were trained in the old school that disease doesn't take a day off, and neither do I.
Wow, okay.
And I think it's they probably have seen a lot of contact lens wearers lose their vision, and that's too high a price to pay in their world when they could step in and do something about it, even if it's Saturday morning.
Wow.
Yeah.
That's good. That's interesting.
They were, Sink and Edinger.
Of course.
Super cool.
And they're all gone now, but
I know. They were trained, both of them were trained in the military, and they always made me stand up a little straighter.
Oh, wow, really?
But I took my calls, and I was glad about that. I learned a lot from them. And so for bacterial causes, the patient is not usually systemically ill, so they don't have a cold. And then, as I alluded to before, the discharge is thick and gross, usually yellow or green. I mean, really purulent.
Okay.
Yeah, super disgusting.
Not much in the way of itching. I just like that.
Yeah.
That sentence is great.
Yeah, it's mostly the disgust factor, and
Just
not so
disgusting,
much,
right? Yeah.
and not so much feeling bad.
Wow, okay,
Yeah, which
okay.
is kind of cool. And what's gross about it, and I've seen this more than once, is you wipe the goo away and it immediately reforms.
Ew.
Yeah,
Okay.
super gross.
Yeah.
Anyway, viral causes. Probably most of the pink eye we see, at least in adults, is viral. So mostly adenovirus, but also everybody's favorite, herpesvirus.
There's a herpes for everything.
Yeah, chickenpox virus, which technically is a herpes virus.
Oh, right.
Yeah, but not that herpes. Epstein-Barr virus. And weirdly, I didn't know this, molluscum contagiosum. So molluscum contagiosum is a little viral wart virus that kids get usually when they're, 3 or 4, kind of in the preschool age. And it looks like, it's flesh colored. It's a little bit shiny. It's about 2 or 3 millimeters, and it has a little belly button in the center of it.
Wow.
They have a very classical look. And kids get it when they're being kids and playing with other kids. But occasionally kids that don't really have a preschool experience or a lot of cousins to play with will not get it until they're in their 20s, and then it becomes a sexually acquired disease.
Oh, no.
It's one of my favorite viruses because it has a super no consequence unless you apparently get it in your eyes. So,
That's it's nothing. It just happens. Oh, you just got that wart. That's
Right.
all it is. That's all that's going to happen.
It doesn't look like a wart in the eyes. It looks like conjunctivitis, so a red irritated eye. But
Sure, in the eye, but elsewhere in the
right,
the,
and you probably just wait it out, and your body takes care of it.
Right.
Yeah. Discharge with viral pink eye is really minimal, but people complain of more discomfort. So more burning, itchiness, and a feeling of grittiness. And the discharge here, it has its own special kind of gross. So it's watery, but it goes into kind of strands of mucus.
Okay.
And that
As opposed to the more pus side of the bacterial.
Yeah.
Oh, gotcha.
the
Okay.
more green and yellow kind of. This is more white and kind of like a chain of goo.
Oh, okay. All right. So, and and you also have a common, like you're sick with something else, right?
Yeah.
Yeah. Okay.
I have a cold.
So this would be like a secondary sort of thing.
No, this would be part of your viral illness.
Okay.
So viral illnesses usually cause a lot of misery in a lot of different levels, and this is just one level of misery.
Gotcha. I gotcha.
So,
okay.
So I actually, when I was working in Williamsburg, Virginia, in their community ER, when I was in training, I was taking care of a kid with probably had adenovirus, and really sick kid, not scary sick, just miserable sick. And he sneezed on me, and I could see the strands of mucus coming to me.
Oh, no.
And I had pink eye for like weeks and couldn't get rid of it. It was super gross, but I took one for the team, and so I went around looking. I had like bright red eyes.
Oh,
for
well,
a long time.
Thank you for your service, for
Yeah.
stepping into the scientific breach.
It's
like
always better when your provider personally understands what agony you're going
Definitely.
through, and I really understand pink eye, man. It's a
man.
bummer.
Wow.
Especially the viral one. And the cool thing about the viral one is, and I always check for this, it's commonly associated with what's called a preauricular lymph node. And so if you think about how your ear attaches to your face and you go to your tragus, which is anybody that has a tragal piercing probably knows where that is, then that's the outside of the ear closest to your nose, okay? Kind of in the middle. And
That's that little lump thing?
yeah, the little
The hard thing?
cartilaginous flap that goes back and forth. Right in front of that is lymph nodes. There are lymph nodes
wow.
all over. Your grandma's only worried about the ones in your throat, but you have ones all over the place, and that's one of the ones people don't really know about.
Right.
If there's a lymph node there, then it's more likely that your pink eye is viral.
Wow.
I
Okay.
know.
Okay. Sure.
And-
let me see. Let me check your pink eye. Let me look at your ear. That's
Right.
great,
I
yeah.
always
That makes sense.
note. I look for it on exam and then note it in my chart notes mostly to like be gee whiz about it. I don't think it really changes.
Look what I noticed.
Yeah, it changes any way that you treat somebody, but it's a super cool little finding.
It's like with the molluscum contagiosum.
I know.
Has no. It doesn't result in anything. It's just a cool little thing.
Yeah, it's what it's doing is it's draining.
It's
the
draining, right? So it's like
conjunctiva,
we're
right, and so it's trying to protect your body from having infection go deeper.
Wow.
Yeah, so
okay.
they're sweet little guard posts. The next one's allergic, and we see a lot of this. And people oftentimes think they have viral or bacterial, but it's the middle of the summer. There's no colds around.
It's itchy,
You
watery
just
eyes,
mow
right?
the lawn.
Yeah.
Usually watery discharge, lots of itching, caused by grasses, trees, pollen, weeds, and dogs and cats. So a lot of environmental triggers, and it makes people really miserable, and they don't really necessarily understand that it's allergic, even though they're sneezing their heads off and maybe have runny, itchy nose and stuff like that. They're surprised that it can also affect their eyes and make their eyes look all pink.
Well, yeah.
But the cool thing about this is there's something called cobblestoning. Now, cobblestoning means a lot of different things in different parts of the body. But when I saw this on somebody,
I don't like that it means anything in any part of the body. But what's it mean for?
Well, diagnostically, it's helpful. Okay. So it means that the conjunctiva gets all swollen, and it's not
Get all bumpy.
Yeah, it looks bumpy, like a cobblestone.
Okay, is that what feels rough when you're in the inside of your eyelids? Feel rough like that?
Yeah.
Okay.
Yeah, it could be. It could be something else.
Yeah.
But it's just like a whole new level of gross. And if you're doing a physical exam on somebody, it's like, whoa, that pretty much pegs the diagnosis.
I love how thrilled you are at the level of grossness about something. I think
was
that's perfect.
thinking of actually talking about what we see when we look at you guys in the line at Safeway.
Okay. Put a pin in that. I do want to come back to that one, but okay, all right. So the allergic ones. This is just your eye. Your
just
itchy,
take antihistamines, and there's over-the-counter eye drops, which are way too expensive considering how cheap they really are to make and distribute, but they're super helpful until you get through whatever it is that triggered it.
And again, with the language, I always just assume, conjunctivitis was the pink eye that your kid came home with from school. I wouldn't have eye irritation from being out mowing the lawn. I wouldn't have called that conjunctivitis. But yeah, it's the same thing. It's just inflammation.
Well, conjunctivitis
of the conjunctiva.
It's pretty straightforward.
Right.
Yeah. And so symptoms that I look for when I'm in the room that make me worry, is this person's eye safe? Okay. So I always ask about this. I said, do your eyes hurt? And they oftentimes they'll have some swelling of their lids, and they'll interpret it as eye pain.
You'd have to be very specific.
I have to go back around and say, does your eyeball hurt? And if I keep saying eyeball, we're focused on, and then I kind of get to it. So eyeball pain is a bad sign.
Sure.
Photophobia is also a bad sign. And what that means is fear of the light. And so if the light hurts your eyes, and so I would say, just sitting in the exam room with a normal amount of light that we would expect in any room during the day, does that make you want to put sunglasses on?
Right. So that could be like nerve. That could be all kinds of things.
That could be a lot of bad stuff. That could be actually a problem with your lens. But next, decreased visual acuity from baseline, and this is where the medical assistants have grown to hate me, is anytime somebody comes in with an eye complaint, it is my practice to get a visual acuity test. So, an interesting factoid aside, the visual acuity test is also in medical abbreviation called a Snellen. Can you go to Snellen on them?
Okay. Is that looking
Dr. Snellen?
Of course. Some old white guy, right? Sure. Yeah.
Was an eye doctor in the mid 1800s, kind of lived in the late 1800s to the early 1900s. And he was the one that developed the little chart with the E.
These, okay.
Yeah. And he was also the one that kind of, I guess, made our understanding of how we put numerical listing for how your vision is.
Oh, the 20/20 sort of thing?
Yeah, the 20/20.
Right. Okay.
But this is cool. So he developed the eye acuity chart, and it is the top-selling poster in the United States.
Really?
Who would think that's a poster? I think that's like, what?
I would thought the periodic table would give it a run for its money, right?
Oh, truly.
Right.
Truly.
Wow.
But yeah, so the Snellen chart.
And so taking that eye test with the Snellen chart, that's how you
Right.
That's a test for visual acuity, right?
Right.
Okay.
Well, he sure didn't live very long. There's got to be a typo. It looks like he only lived 16 years. I doubt it. I think that's wrong.
Okay.
But anyway, that's who Dr. Herman Snellen is. And then the medical assistant always looks at you and they say he says his vision's fine, and then they get the test and it's not.
Oh no.
Yeah. So symptoms of concern: eyeball pain, photophobia, which is pain with light, decreased visual acuity from baseline. So, a lot of kids will have 2013, which is way better than 2020 or 2010. But if somebody adult maybe has more like 2040, if they become 2200, that's a problem.
Wow.
Yeah. Injury, an actual injury. So I did see somebody once in the urgent care times where her dog, she had a little lap dog that actually the claw, the dog hopped up and accidentally clawed her eye, her actual eyeball. And when I was evaluating it, I was watching the vitreous, which is the internal goo that's inside an eye, leak out. So once again, called Dr. Sink and Dr. Edinger, and they freaked out. They didn't freak out because they're in control, but they were alarmed enough that they let me send her down.
Wow. Yeah.
And then I always ask if somebody is a contact lens wearer because I want to know kind of what I'm doing with it. There's no real good place that we can send these people. They used to automatically get sent to the eye doctor, but that's not a thing here. No. So it would, whether somebody has contact lenses or not, guides my advice on how to take care of this, which means they can't wear contact lenses for a week or two, and also guides my choice of antibiotics.
So what do you do then here in a community without an eye doctor handy? Like you say, it does change. So how does it change it?
I think we take more risks. And I think people end up in the ER where there's a slit lamp, which is that little tool that if you're getting glasses that they look in the back of your eye, that's why they dilate your eye. Kind of annoying. It's a really bright light. But there's not a lot of medical providers that necessarily know how to use it.
Right.
It's kind of a really specialized skill. And I believe they have one in the ER. And I do believe that those, at least some of the providers there know how to use them. And I would imagine if they had something catastrophic that they would send people out to probably Humboldt, depending on where they could get him and what the insurance would allow. So anybody with, like that lady who had a penetrating injury to her eyeball from her dog's claw, I think now she would probably get sent to the ER and probably flown out.
But what about you? What about you with somebody who is a contact lens wearer and they come in?
It changes my prescribing and my recommendations for follow-up, and then I get to scold them a little bit about don't clean your contacts very often, stuff like that.
Okay.
And then, the signs and symptoms of concern are a little bit different in what I tell them.
Wow, okay.
Yeah, so pink eye, who knew? There were so many interesting things about it. So I've been reading about it all week, not to mention seeing it. But
is there a seasonality to pink eye? Does it go with the school year, that kind of thing?
Oh, yeah. Totally. And, I should say that newborn babies, if they're born in the hospital, they're tested for gonorrhea and chlamydia in their eyes.
Oh, wow.
Yeah,
wow.
That's why they get the erythromycin ointment
put
in there. It's one of the reasons. I think there's probably multiple.
Because that's like a port of entry for a newborn going through the birth canal, right? Basically, is
right.
Wow.
But we see very few pregnant women here that have STIs. Certainly see some, but it's not super common.
Well, good.
Yeah.
Wow. So earlier you said something about what you see as a healthcare provider standing in the line at Safeway, when you look at just looking at people.
I was thinking about doing a show on that. Actually.
What sorts of things do you see? Let's do a little preview of it. We've got a few minutes here.
Preview?
Yeah.
I think the color of their skin. Older people with COPD, their nose is kind of blue or purple.
Wow. Okay.
I think the relationship of their torso, what the diameter of their torso is, because certain lung diseases, it's thinner and sometimes it's bigger.
Wow.
Depending on how hard it is for them to breathe. Kind of look at their vasculature, like, where would I put an IV in? Or look at skin lesions, especially in guys' ears for some reason, because men wear, baseball caps and oftentimes don't think about their ears as a place where they could get cancer.
Oh, wow.
Skin
Okay.
cancer. A lot
Yeah.
of them do. We're always, I think the thing of more interest is we're always looking at people. And, sometimes we see things that we might comment on.
Right.
Like, I don't know if you know, but the back of your neck has something going on back there. And I really think you ought to see your provider.
Have you encountered things like that where it just maybe,
yeah.
yeah.
Yeah. And most of the time, when I'm not in the clinic, when I'm in the clinic, I'm in scrubs. When I'm not in the clinic, I look like a 70s hippie chick. So unless they know me, I don't think I have much credibility by randomly saying something.
It seems awful creepy, right?
It is. It's like, are you a stalker, lady? Stuff like that.
Mm-hmm.
Like, why don't you come see me? I could really help you with that.
Do you recall? I mean, it just is so fascinating to me. What's the worst thing you found like that? Like, have you saved somebody's life by just like going, okay?
No, not that I know of, because I'm not always the one to follow them up.
Okay,
Yeah.
sure.
So
sure.
not that I know of. The worst thing, that I actually told somebody about.
Yeah.
Probably skin cancers.
Really, yeah. Yeah, get that.
Yeah.
That looks weird. You should have that looked out. Yeah,
Yeah.
that's it just offers itself kind of on face value. Yeah.
Or if somebody's coughing a lot
Mm-hmm.
and not, I'll say, that sounds like it's kind of a reactive airway phenomenon, maybe from a viral syndrome, but I'll try and say it in understandable stuff.
Right.
I bet an inhaler would help you. And then they're like, yeah, lady. And they move a little farther away from me on the group W bench.
Well,
So,
which is which is good because they were coughing anyway. So
that's fine. Fine.
So yeah, we'll have to wait and we'll talk about the pool here in a couple of weeks, and I'm still excited about that. I'm kind of on the fence. Now you go to the pool, right?
Yeah.
Okay, so are you going to go to the one in Brookings? Are you one of those people? I was reading.
It depends on what time it's available.
Mm-hmm,
The availability might be the thing for me.
Yeah.
But I want to talk a little bit about Teen Clinic.
Okay.
So Teen Clinic, so College of the Redwoods is doing this really great thing. It's opening up more classes for ancillary medical professionals, and not for the professionals, but for people to become professionals. And that's like a lab tech or an x-ray tech. And as part of doing that, the building parts that Teen Clinic inhabits right now is we've kind of gotten evicted in the kindest way possible, okay? Because we've been there a long time. And so Teen Clinic looks to me now that like it's going to be relocated to what's called the Two Trees.
Okay. I know where that
building, which I think is an administrative building. There's a lot of confusion about what that is, but locals seem to know it better than I do. Kind of near Best Maxwell,
Right
kind
across
of
the
to the
street there.
side of
Yeah.
it. So it's still within an easy walk, even if it's raining. And we're still going to be there at the same time, Tuesday 1 to 5. And super excited. The space is small and not as well decorated, but we'll fix that.
Yeah.
I'm bringing my condom Christmas tree.
Oh, good. It is the season.
Yeah. So I just wanted to say that because the teens need a place, and we're doing a good service for them. And I want people to know that the community rallied behind us, and we were able to find a new home relatively easily.
Wow, that's great.
Yeah.
When's the move happen?
Don't know.
Okay.
It's all very vague.
Okay. And
And if it changes, I suppose that could be a possibility. I would let you know. But it is a location that we've been before. With the initial teen clinic, when Dr. Groves was doing it, she had it all remodeled and stuff. Although that was some years ago. I don't know what it looks like now. So looking forward to maybe even input from the teens in designing their own space.
Right on.
Yeah,
Yeah, and
super cool.
that's right there. That's just as convenient. That's right adjacent to the high school too. I mean, it's not
Right.
just across the parking lot anymore, but it might as well be.
Right.
It's just right there. Yeah,
Right.
cool. Good.
Yeah.
Okay,
So I
good.
thought that should be out there.
That should be out there. And we should perhaps focus an episode on the teen clinic. Well, again, I know we've done it in the past, but it might be time to revisit it again.
Oh, it's my favorite part of medicine.
Really? Okay, see, there you go.
They have a lot of fears, a lot of political fears. They're not very savvy politically, except they know it's bad for them.
Okay, well then let's maybe in conjunction with the move when it happens, we can do something.
We'll talk more.
Okay. All right, we will indeed. Thank you very much. It's Health Matters. Thanks, Lynn.
Thanks.